So today I'm going to be doing my skill for inserting an NG tube and removing an NG tube. So I'm just going to come into my med room, and so my patient is Joanne Jones. So I'm going to look at my order here from Dr. Jeff, which is her physician. She came into the ER and she was admitted for bowel obstruction. So Joanne Jones, date of birth 12/3/67. Jeff Moberg is her PA, and her allergies are penicillin. And so we're just going to be getting ready to go and insert her NG tube. So that's what we're going to do. So I'm going to have all my supplies ready. So I have everything I need. I have my NG tube, have my chuck, I have my syringe, water for Joanne to drink, and I'm good to go to Joanne's room. Just outside the door here, I'm just going to go ahead and check again, make sure that I'm doing my NG tube for Joanne Jones, checking I have the right room. I'm going to perform hand hygiene, and then I'm just going to get a pair of gloves. These ones. Put on my gloves. Knock, knock, Joanne.
Hi.
How are you today?
I'm doing good.
My name is McKenna, and I'm going to be your student nurse. And I'm not sure if Dr. Jeff talked to you, but we're going to be putting in an NG tube today, okay?
All right.
Okay. And then I've heard you've had one before, is that right?
Oh, yes, ma'am.
Okay. Can you confirm your name and date of birth for me?
Joanne Jones, 12/3/67.
Okay, and then your allergies. Is it penicillin?
Yes, ma'am.
Okay, just going to check my order here. That sounds right. Okay, and then are you having any pain today, Joanne, on a scale from 0 to 10? 0 being no pain, 10 being the worst pain. What would you rate your pain?
0 pain.
Okay, perfect. So we're just going to sit you up here to a good working level here first. And you want him in a high Fowler's position. Okay. We're just going to move your pillow, okay, Joanne?
Okay.
Okay, and then also you can use your stethoscope, and you would want to listen to bowel sounds in the right lower quadrant, left lower quadrant, just to see if anything has changed from the last time. So after you do that, then I'm just going to go ahead and get everything ready. So I have my assistant here, Cassie, so I'm going to give her the glass of water for Miss Joanne. I'm going to lay out my chuck. Joanne, are you allergic to any adhesives?
No, ma'am.
No? And then have you had any facial injuries, any skull fractures, any nose injuries?
No, ma'am.
No? Okay. So I'm just going to take my pen light here, and I'm just going to shine up your nose here, make sure that we don't have anything in the way. Look in your mouth. You'd also want to check with for a gag reflex with your tongue depressor. So then, now that I've done that, I'm going to get ready to measure my tube here. Okay, so we're also going to have that for you, Joanne. Oh. Okay, so to measure your NG tube, you're going to take it and you're going to start at her nose here, and you're going to go to her ear, and then you're going to pull down about to her xiphoid process right in there, which looks like I'm getting about 50, 53. That's what it looks like. So then I'm just going to go ahead and take my Sharpie. I'm going to mark there. And then I'm also just going to go ahead and stick a piece of tape there. I'm not going to do it too tight, just loose enough so that I know when I need to stop. Okay, and then I'm just going to go ahead and take my lube before inserting my tube here. Okay. And I'm going to close off the end of my tube. Oops, the end of my tube. Okay, and now we are ready to go. Okay, Joanne, so what we're gonna do is I'm gonna have you kind of tilt your head back, and then I'm gonna go ahead and start inserting the tube. You might gag and cough a little bit, that's normal. Just go ahead and take a drink of your water, and then you'll tip your head forward, okay? So, are you ready?
Yes, ma'am.
Okay, 1, 2. Tip you forward a little bit.
Good job. Keep swallowing.
right there. That's where we need it to be. So then after we do that, then I would go ahead and I would use this and tape it to Joanne's nose, but because of her skin, it won't stick. So I'm not gonna go ahead and do that. And then I'm gonna safety pin her NG tube here to her gown. Just wanna make sure it's right about there. Okay, and then there's 3 different ways you can check to make sure that your NG tube is in the right place. So you always want to have an x-ray done, so you would call radiology, have them come in and do an x-ray. You could also take your stethoscope and listen for air in her stomach. And then the other thing you can also do is check your pH level, which we'll do. So I'm just going to go ahead and take my syringe here and uncap the bottom. I'm just going to pull up enough content here to test, so about 5 is plenty. You also want to check what your content looks like, make sure it looks normal, and then go ahead and put it into a cup. And then you would use your pH strips and go ahead and test that content. And it should be between 1 and 4 on your chart here. So that looks good. It looks to be about a 3, which is normal. Okay, and so then after that, then you would have your radiology check and everything. And then you'd want to document, so you'd want to document how Joanne tolerated the procedure, where you marked your mark, which I marked it at 53. And you'd want to document what your stomach content looked like, what the acidic level was, and all of that into your documentation. And then for video purposes, I'm also going to demonstrate how to remove the NG tube now. So, okay, Joanne, Dr. Jeff said we're going to go ahead and remove your NG tube now. So to do that, you would set it up with your stuff here, make sure she has a bag just in case. And then checking your order again, making sure, yes, Dr. Jeff wants her tube removed. Then you should be able to take your syringe here and you want to flush out your tube with air. So I'm going to pull up about 15 to 20 milliliters of air. I'm going to undo the end of my tube here. This just gets rid of any content that would be in her tube before you remove it. Okay, and then I'm just going to go ahead and unpin it. I would also take the tape off of her nose, and then we are good to go. So, okay, Joanne, I'm going to have my assistant here to help too, and just on the count of 3, you're going to hold your breath, and I'm going to remove the tube, okay? So 1, 2, 3. And then you would wrap everything up into your chuck here. And then you'd want to dispose of this properly. If she was hooked up to suction, you would want to make sure you disposed of your suction properly and everything like that. I would have also changed my gloves between there as well. So between applying it and removing it, you'd want to change your gloves. And then I would document. So I would document how Joanne tolerated the removal of it and everything, how much air you aspirated into there. And then after that, you are done.